ಹೇಳು ಹೇಗಿದೆ ಇದು ಟ್ಯೂಷನ್ 4ನೇ ದಿನ ಅಲ್ವ ಚೆನ್ನಾಗಿದೆ ಇಷ್ಟ ಆಯ್ತಾ ಇಷ್ಟ ಆಯ್ತಲ್ಲ ಹೋಗ್ಬೇಡ ಅಂದ್ರೆ ಹೋಗ್ತೀಯ ನೀನು ಇವಾಗ ಮಾಡು 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 ಡ್ಯಾನ್ಸ್ Hi, most of the Indian patients who are on dialysis, they might be vegetarians. So they ask me, sir, what diet can we take so that our kidney function improves and we can decrease the dialysis? It's a myth that the diet will change or reverse the kidney function. See, because of financial problem, we might reduce the dialysis sessions. Instead of doing thrice a week dialysis session, we might ask twice a week dialysis session. This is because of financial constraints, and we monitor the other parameters like potassium, phosphorus, overall well-being. Is the patient able to sleep? Is the patient able to eat proper diet, adequate proper diet? If everything is okay, then we might continue twice a week dialysis. But usually most of the patient requires thrice a week dialysis. And most of our dialysis patients are vegetarian and they want what diet they can eat. So this video will be for those patients who are a vegetarian on hemodialysis. So they also need a high protein, high fiber diet. The universal thumb rule of low sodium fluid restriction applies here also. In the morning they can eat apple or a pear. They can take idli, 3 to 4 idlis along with dal sambar. Try to limit chutney and potato palya. And in the mid morning they can take snacks, high fiber biscuits they can use along with low milk, low fat milk. They can also use green tea or a black coffee. In the afternoon they can take chapati, that is refined wheat chapati, along with boiled they can use some dal tadka, or they can use paneer curry, and they can try that in the afternoon. They can use 2 eggs along with the diet, or they can use that in the mid morning snacks or in the evening snacks. So they can either use chapatis or they can use white rice along with the dal tadka. In the evening they can in the evening snacks they can try a fruit like papaya. Papaya and pineapples are usually contains low potassium. And in the night they can if they have used chapati in the afternoon, they can use white rice along with paneer curry if they have used dal in the afternoon. So this is how you have to plan. So usually they have to take around 1.2 grams per kg per day of protein. In case they are taking less proteins, I think we have to supplement with the whey proteins. So the renal whey protein usually contains low phosphorus and low potassium. So it is not a regular whey protein which has been taken by all the regular patients. For CKD whey proteins, it has to be separate, okay, where it contains low phosphorus level, because the phosphorus usually gets accumulated, and when high phosphorus is there, it causes bone disease as well as cardiovascular events. So this is about vegetarian diet in a CKD patients on dialysis. Few points which CKD patients on dialysis should keep while consuming diet is they have to regularly check potassium. See, this is the most dangerous problem in a CKD on dialysis or without dialysis, because this causes complete heart block and sudden patient can collapse because of hyperkalemia. I'm not worried about high creat, but I'm always worried about high potassium level. Second, the phosphorus. They have to keep checking phosphorus every 3 months. If there is a high phosphorus, then we have to target low phosphorus diet. Diet which has high phosphorus are dairy products, meat, nuts. So this contains high phosphorus. We have to plan for a low phosphorus diet. In spite of this, if the phosphorus is not controlled, then we have to give a phosphate binders like salvama or lanthanum carbonate. Third is the low sodium, so they have to take less salt, and they have to restrict the fluid. Each patient is different, and you have to meet either a physician or nephrologist regarding how much fluid intake and how much salt has to be taken. So normally keep it low. Don't try to take fried items or bakery items, pickles, papad. All this you have to try to avoid. Next is the protein intake. So there should be adequate protein intake. So once the patient is on dialysis, many patients are already used to low protein diet because of low renal function. It's not their problem, because when the kidney function is low, usually nephrologists or dietitians say to take a low protein diet. But once patient is on dialysis, they have to switch to high protein diet, high protein high fiber diet. That is, the protein intake should be around 1.2 grams per kg per day. If they are not meeting this requirement, I think we have to supplement the whey protein, which contains low phosphorus, to these patients. Thank you.
పెట్టండి ఓ ఫాస్ట్ అండి పకోడా